So as sir was telling, yes, we do hear a lot of issues, and especially after COVID, I think it's a great concern to see, especially parents telling about this digital era and increase in screen time. So sometimes we also get puzzled what to do, how to tackle this, because now invariably or inevitably everybody has to go through screen time, especially not only kids but everybody. So but as the previous speaker Wilson was telling, it's a double-edged sword. I always used to tell, like a balanced diet. So we have to know when and where, at the right time, at the right quantity, how to use the screen time. So what I have done is I have taken out some 10 questions that I see in and out in OPD from parents. Then I thought I'll discuss. So first question, like most of the time that I hear is, I have heard that screen time has an effect on children. What is meant by screen time? So definitely, like, screen time means any exposure to digital media, whether like whatever it is, whether it can be a tablet, whether it can be what you say a television. So all together, the definition falls in that. So before going to this, there are some things which I wanted to tell you. There is something known as active and passive screen time. So because if I tell this, then only our discussion will move forward. Active and passive screen time. So what is this active screen time? So most of the times now we are in a meeting, so we are interacting, so we are doing it for a purpose, or simply our brain is working. So for example, if a kid is attending an online classes for hours together, so yes, he or she is attending an active screen time. What is this passive screen time? Passive screen time is nothing but some things that we generally scroll through our walls, FB or WhatsApp. We just go through, and some other things we randomly see YouTube videos for hours together. We see Netflix for hours together. So this is known as passive screen time, and this is known as active screen time, right? So as I told, the screen time means the total amount of time that is spent in screen. So after COVID, if you take, especially during the lockdown period, there are kids, or if you see, in 24 hours in a day, definitely we sleep for if you see 10 hours or 8 to 10 hours. So rest we have 14 hours, and believe me, I have some kids who used to tell, I used to track day charting, and whatever for active or passive, I have some kids who have been watching at least 12 to 14 hours per day the screen time. And they used to sleep for some maybe more than 6 to 7 hours. That's it. Some used to sleep for 3 hours. So I'll tell how I used to track and how they used to tell. So second time is how long can my child use screens, and should I limit screen time? So this question is very big, and on top of that, we have discussed this when I was, especially during this COVID time, I was in immense, and we used to debate anything in all conferences, what is the set limit for set age for the screen time. So beautifully, WHO has come out with the guidelines. So they have put forth, this is before COVID, okay. So they have clearly put forth the guidelines, and they have told, what they have clearly told is less than 2 years. Less than 2 years, no screen time is allowed. Less than 2 years, there is no need of screen time, because it's the time that the brain is developing, and synaptic plasticity develops during this time, and it's what you say, it's necessary that the kid should not spend too much time in that will impair the development of the brain. And they only clearly tell that only video calling, when needed, is required. And they next thing they have divided is about the age group that we all majorly see is less than 10 years. They clearly tell is that less than 1 to 2 hours, less than 1 to 2 hours, less than 1 hour, they say. And the main catch here is supervised screen time. Supervised screen time or co-watching is mandatory. Co-watching is mandatory. So that clearly says that whenever you give the screen to this children of 2 to 10 years or 5 to 10 years, you stay with them. Parents should stay with them. They should not be left alone. They should watch in a supervised manner. And another thing they clearly tell is that they should watch in a space which is very common. That is, they should not go to the bedroom and segregate themselves. They should watch in a common screen. And other thing they clearly emphasize is that during this time of less than 5 to 10 years, they should always try to watch in a big screen rather than in a small screen like mobile and tablet. Big screen, I meant a laptop or a common TV screen, right? So more than 10 to 20 years, more like 10 to 18 years is the guideline. They clearly tell they have segregated into active and passive after this COVID, and they clearly the guidelines is clear. It should be co-watching. Again, like for 18 years, it should be co-watching. But they again tell it should be based on the individual's needs, not more than 3 hours or 2 to 3 hours a day. Not more than 2 to 3 hours a day. But definitely after the invent of COVID, after the after the this COVID, we all know that these regulations have thrown apart because there are schools which have conducted more than 10 hours per day online classes. So when I used to tell, it is just 2 to 3 hours per day that you are allowed to use screen time. So the parents used to tell doctor at least 8 hours he or she will be having online classes. Then how to tackle that? So yes, I will tell that over the time. So what is the effect of screens for a prolonged time on my child? The most common thing that happens is that something which is known as virtual autism. So definitely, if I can segregate into parts, definitely this increase in screen time is going to affect your physical health. So most of the time, what we have seen is obesity, right? Obesity has been a rampant surge in the last couple of years, especially due to lack of physical activity. Other thing is like disturbed sleep. Disturbed sleep, and this disturbed sleep can lead to mood changes in kids. Other thing is like mental health issues. What are the mental health issues? So most commonly what happens is that, especially like in the age group of 2 to less than 2 years, this is the place where brain develops and delayed speech and delayed milestones. Okay, delayed speech, delayed milestones, and socio-emotional reciprocity. Socio-emotional reciprocity happens only after seeing others' emotions. What I meant by reciprocity is like, so for example, if you take a kid of 2-year-old, she cries when the mother cries, or she feels sad when the mother cries. This happens after like multiple emotions between the mother and the kid. So these kind of emotions, or this transition of emotions is not happening because the child is stuck in the screen time. So because of this, what happens is that there is a condition that is called virtual autism. So the kid, autism usually happens because of neurodevelopmental neurodiversities. The kid usually doesn't have autism, but due to lack of connectedness or lack of interactions, we can see like the kids after like going to school or something, they have difficulties in interacting with people, because in autism, what is the main component is that they have difficulty in interacting. So these kids who have brought up in a such way, they used to see a difficulty in connectedness or difficulty in interacting with people, and virtual autism is rampant, because especially in those kids who have been exposed to screen, and they have been exposed in a very less way. And there are some syndromes that has clearly been documented, which is known as FOMO and FOBLO. That is fear of missing out, and fear of being left out, which is known as FOBLO. And also there are rampant issues of social anxiety that is happening, because now after this COVID things, I have been seeing kids going directly to school at first standard. LKG and UKG, they have been sitting in the online classes. So what has happened is rampant increase of school refusal and social anxiety, because they have never seen such a crowd. 30 students they have never seen, so they don't know how to interact, and that actually is stemming up. Okay, so other thing is like reduced school performance, which I will tell how. So other, yes, we all tell balance screen time with other healthy activities like reading books, and I have told excessive screen time, reducing time spent on physical activities, right? So all screen children seem to be using the screen time nowadays. Are there any benefits? Yes, there are benefits. So I'll clearly tell there was a study. They clearly, even WHO clearly tells that in the guidelines, it is always better that minimum amount of screen time is better than no screen time. Minimum amount of screen time helps in lot of other things like learning and knowledge, a tool of social communication, and what you say. There are a lot of smartphone app and learning apps that has come. Okay, I'm not really going into that. So yes, there are benefits too. Yeah, this is the maximum number of questions that I used to get whenever I go to parents meeting. What is the right age to introduce computer, mobile, television for my child? Okay, so like before that, I'll tell this is like another question. Children waste a lot of time on Facebook, WhatsApp, Snapchat, Twitter. They will interact with strangers. Should children be allowed on social media? What is the right age? This right age question. So again, this is the guideline that have put up by Association of Psychiatrists. So why this guideline? Before that, why this guideline? I want to emphasize one thing. So we clearly tell 18 years. People used to clearly post 18 years is the time that I become autonomy. Why this is 18? Why it is not 17? Why it is not 20 or 21? So we have to know there are some basics of this. Why we have kept this as 18 years? Because our brain developed in such a way that our frontal lobe is the area. Frontal lobe is the part of the brain as well. It is an area which help in decision making. The complete maturation of frontal lobe happens at 18. That is why even if you do a crime before 18, you are not punished, or you are not punished like an adult. Because the sense that I have done a crime that is wrong or right happens only at 18 years, or brain is mature at that age. So that is why like each of the social media or social media apps are designed such a way that that is connected with the developmental age of brain, because the developmental age or the spectrum goes in a continuum where at each stage of life, each stage we have certain developments happening. So they clearly tell Facebook, Twitter, Snapchat, Instagram, the minimum age is 13 years, because this Facebook, Instagram, what the child just wanted to know what is right, what is wrong, when to respond, when not to respond. But yes, if it is PUBG, it is 18 years, right? But if it is WhatsApp, it is again 16 years, but it is YouTube, it is again they clearly tell 18 years, 13 to 18 years requires parental permission. So each devices, for example, each game, because when we learn psychiatry, we have a special module which is known as the art or science of gaming, where they clearly tell the age appropriate gaming for individuals. So for example, everybody has played racing games, right? So how much ever I am interested, I'm not interested, we play, and at the end of 2 minutes, if we won, we'll have a feeling of wow, and we raise our hands. That is because there is a dopamine surge that is happening during that time, and the immediate gratification that we get is very high, right? So similarly, this messaging apps and other things have designed such a way that the time that when we get a replay, the same dopamine surge is happening in the brain. Same thing, even in PUBG, the Clash of Clans has been designed in such a way that how our dopamine is or the serotonin is altered, right? So there are some online etiquette, how can I make my children follow good online manners? What should I do when others post messages that hurt my child? So this is one concern that many of my parents have been because of the abuse that is happening. So first thing that I will tell parents is that, see, there is no point that you should be rude, or you should tell that I will not give phone to you, and we should just tell that we should keep a restriction. Always I believe in giving shared responsibility or age appropriate responsibility. Age appropriate responsibility, that what I meant is, if a kid is at 6th standard or 7th standard, we should be giving him responsibility that this is your screen time. We'll give 1 hour of screen time to him. After 1 hour, he or she should give phone to the parents, right? So shared responsibility is always better.
Dr. Neeraj, would you be able to summarize, because
I know, sir. I'm summarizing.
Yeah, we'll go in detail after the
discussion. Yes, sir. I'm summarizing. So, like again, like the shared responsibility, I'm telling shared responsibility is better than like other. The like 2 to 3 things like this all everybody knows how their position of other screen times. So this I just wanted to tell. Yes, I have read that media is addictive as drugs. How will I know that child is addicted to media? Can media addiction be cured? Yes. So everybody, like most of the parents used to come and tell me, my child is addicted to social media. So when and where we should know that we should use the term addiction. So first thing is like, it's very simple. When it causes a dysfunction in your life, that the child is not going to school, the child is clearly having some dysfunction or like some issues in interacting with others, mood issues. Because of this, child is having temper tantrums or sudden disruption in sleep, sudden disruption in using like in appetite, losing not eating food. And these are the early warning signs that you should know that the child is addicted to social media. Okay, so I am very careful about screen use. Does my screen time have an effect on my child? Yes. So I always used to tell that kids to watch us, and it's not that we just preach that you please use for 1 hour. Always the role model is the parents themselves. So I always used to tell in every family there should be a time at least 1 hour per day that they should use screen-free time, that they should interact with their kids. Parents should hear what the kids wanted to tell, and also the parents should tell to their kids not about the academics or something. So there are so many things that a parent should tell to their kids. So 1 hour per day in every family there should be a time without screen. So even when we are eating, if the parent is using mobile phone, even when we are driving, when the mother is using mobile phone, definitely they learn by seeing us. So be a good role model, then only we can change our kids. With this, I think I'm stopping, and yes, definitely that we'll discuss. We should enable them to fail in their life. So it's okay to we should, because most of the time the reason for internet addiction, or most of the time what I have gone through is that the lack of pleasure in their life. So most of the times what happens is that for example, if you do like gaming, we get instant pleasure, but in real life we may have to wait. For example, I study, I wanted to wait for 6 months to get the results. But here, in most of the digital media is designed such that we get pleasure instantly, and our brain is tuned to that. So we must have to enable our kids that to say that it's okay to fail.